Hey there, this is Melissa, Mads, Sydney, Emily, and Jen, and we are here to teach you a little bit about growth and development for infants. First, growth and development milestones. During a baby's first year of life, they grow and develop at amazing speeds, accomplishing major achievements such as rolling over, sitting, and standing along the way. Developmental milestones are things most children, by saying most, we mean 75% or more, can do by a certain age, and on this slide we've highlighted a few of the many growth and development milestones that typically occur during an infant's first year of life. Often, during those first 12 months, babies learn to focus their vision, reach out, explore, and learn about the things that are around them. However, each baby is different, so it is not unusual or immediately deserving of concern if there is slight variation amongst the timing and speed with which an infant develops. This slide shows you a little bit about some of those milestones. If you've ever taken an Intro to Psychology course, you're likely familiar with the names Jean Piaget and ERIK Erikson, both influential thinkers and theorists. Piaget and Erikson significantly impacted the field of psychology, especially within the area of child development. Proposed by Piaget, the theory of collective development consists of 4 various stages that he believed all children pass through sequentially in their lifetime. The first stage, termed the sensory motor stage, represents the period from infancy and up to 2 years of age. During this stage, children develop a high level of curiosity and begin to develop sense of self as they are able to differentiate themselves from their environment. Additionally, object permanence is developed as children become aware that an object continues to exist even though it is no longer visible. While Piaget focused only on infancy to the late teenage years, ERIK Erikson picked it up with the theory of psychosocial development, which gives us a way to view and understand the development of a person through one's entire lifespan. An ego psychologist, Erikson believed that an individual's personality develops in a predetermined order through 8 specific stages. Each psychosocial stage has 2 components, the favorable and the unfavorable aspects of the core conflict, and progress to the next stage depends on resolution of this conflict. Erikson's theory maintains that development centers around the psychosocial conflict of trust and mistrust as the young kiddos look toward their primary caregivers for stability and consistency of care. If the care the infant receives is consistent, predictable, and reliable, they will develop a sense of trust that will be carried with them to other future relationships. However, if they do not, then mistrust, suspicion, and anxiety may develop instead. Play is the primary way that infants learn how to move, communicate, and understand their surroundings. Infants have short attention spans, but play should still provide interpersonal contact and educational stimulation. Children will participate in solitary play, meaning they will not play with others, and should be given appropriate toys and activities that simulate the senses. Examples of these are listed. Crying is the first form of communication used by the baby. The amount of crying will fluctuate and most often levels off around 12 weeks of age. Language will then develop on a spectrum and will have subtle differences from child to child. Several language milestones are typically reached between 3 and 4 months, 9 to 10 months, and 1 year. As an infant grows, they will sleep less during the day and more at night, hopefully, until they are sleeping through the night. Breastfed infants sometimes have more trouble sleeping through the night compared to formula-fed babies. Babies should be put to sleep on their backs, although they may roll. Mattresses should be firm and fit snug in the crib. No toys or pillows should be in the crib. Cribs should be in low position with sides up, and the slats should be 6 centimeters apart. While breast or chest milk and formula are great for babies, cow's milk is not a good addition until after 1 year because it's not nutritionally complete and it is difficult for babies to digest. Babies usually take 6 feedings a day after 1 month of age and decrease to 4 or 5 after 6 months. Most babies can do on-demand feeding, in which they choose when to eat by signaling a parent, but some babies, like ones who are not gaining weight on a schedule, need a more rigid feeding schedule to ensure they are getting the nutrients they need. It is not uncommon for babies to continue breastfeeding up to 4 years of age, but the last milk feedings to go are usually those at bedtime. Introducing solids before 4 to 6 months puts babies at risk of developing food allergies. One way to tell if a baby is ready for solid food is the disappearance of the extrusion reflex. This reflex happens when you put solid food into an infant's mouth and they push it out immediately. Babies should be able to sit upright and turn their heads to turn away from food when they are done being fed. Begin by replacing one formula or human milk feeding a day with solids. Fruit juices are not appropriate to add until after 1 year of life because they're not nutrient dense. Honey should also be avoided because it puts infants at risk for infection with botulism. When introducing foods, avoid things like grapes, which babies can choke on. And when new foods are introduced, give about 5 to 7 days for the infants to show signs of intolerance or allergies before adding another. Starting with the least invasive, we observe the head and neck for the general appearance and symmetry. We also look for flat spots on the head, which can indicate the child may need more tummy time. To evaluate ROM, we first look to see how the baby is moving its head and neck on their own. We can then guide the child through positions. Any limitations should be further evaluated. The neck should also be inspected, as it is normally short with skin folds, but will lengthen as the child grows. Dental caries in infancy is often referred to as bottle mouth because it's caused by prolonged exposure to sugars that can be found in milk, and is considered the most prevalent chronic condition affecting young children. The good news is that this is preventable. As nurses, we should be educating caregivers about the causes of dental caries and how to provide proper oral hygiene. We should also explain the importance of oral health exams that should start at 6 months, but may be needed earlier if the child is experiencing red or irritated gums or discoloration of teeth. Administering medications to infants should focus on providing non-traumatic care and will differ from child to child. There are general recommendations provided, but if parents have difficulties or questions, they should refer to their pediatrician. All medication administration should prioritize atraumatic care, and there are many different techniques that can be used for these different routes. Since by-mouth administration is preferred and most commonly used, providing education to the caregiver is essential. The CDC has a large campaign stressing the importance of using mLs measured by appropriate devices rather than teaspoons or tablespoons. For immunizations, consent should be given from the parent or guardian, and education should be given prior. The recommended ages for vaccines are at birth, 2 months, 4 months, 6 months, and between 6 to 18 months. When a month range is listed, it is based on preference of the provider and/or the parent or guardian. Congenital abnormalities occur during fetal development in the uterus and are typically diagnosed prenatally or shortly after delivery. These disorders can affect any organ in the body and be classified as structural or functional. When assessing the child, we prioritize physiological stability, ABCs, temperature, food, hydration, and once these needs are met, we move on to the psychosocial part of the assessment. While there is a lot of care focused on the newborn, it is also important to provide support to the parents of the child, as this process can be scary and require additional education. These are some examples of some congenital anomalies you may see in infants. According to the CDC's Childhood Injury Report, unintentional injuries, such as those caused by falls, drowning, and suffocation, are the leading cause of morbidity and mortality among children in the United States. And for children less than 1 year of age, 2/3 of injury deaths were due to suffocation. Given the devastating burden of childhood injuries, we have highlighted a few simple yet effective guidelines for parents and caregivers so that the risk of unintentional injury to infants is hopefully reduced. Thank you so much for joining us, and we hope you learned something from our PowerPoint.